Good morning, Mrs. Harrison. My name is Cameron, and I'm going to be your nurse. How are you feeling? Excellent. Well, today we're going to be completing what is called a Mohs procedure to help remove the cancer present in your cheek. The whole procedure is going to take about 3 to 4 hours, and first you're going to meet Dr. Hartman. Dr. Hartman is a dermatologist and an oncologist and a surgeon, which means he's a doctor who studies cancer and skin cancer specifically. I have known Dr. Hartman for years, and he is one of the best. He's going to come in and do an examination and see what needs to be done for the procedure to help get the cancer out. We're going to get you set on an anesthetic and then start the procedure. Basically, in this procedure, the doctor is going to locate the basal cell carcinoma, which is the cancer tumor in your epidermis. The epidermis is the outer layer of your skin, and the area we are looking at is the surrounding of your zygomatic bone, which is the left side of your face and cheek, right here. Basal cell carcinoma is specifically a type of cancer that affects the very outer layer of the skin. It affects the basal cells, which are the cells that are on the outside of the skin that shed off when the new ones come. This type of cancer is just caused by overexposure to ultraviolet radiation. So anything like lots of tanning in the sun or in a tanning bed, and it just causes DNA damage. It's going to cause those skin cells to grow really rapidly and cause way too many of them to be there. So, to combat that, the doctor will perform a biopsy, which is just going to be a surgical excision of the area, and he's going to see what extent the cancer has grown. Then they're going to do what's called a debridement, and that's going to remove the cancer mass using this dermatome. This dermatome is a nice little device, and it's just going to gently scrape away the affected cancer cells. Afterwards, they're going to stitch you up, and you're going to be good to go. The surgery has a 99% success rate in removing cancer. But I am going to warn you, it does have a high chance of scarring. So when they put in the stitches, there is a chance that it might cause a scar, like right here. Now, there are a few things that we can do to prevent the scarring. We're going to need you to stay hydrated, drink plenty of water. You need to make sure you're eating regularly. I'm going to ask you to try not to smoke anything. Try not to go out in the sun, and don't sit in the sun until we can get these stitches out. We're looking for as little sunlight and time in the sun as possible. We're also going to get you a prescription for a steroid cream. It's going to look like this. And that you're just going to apply to the area, and then when you come back in to get the stitches out, the doctor can re-examine the area and see what else needs to be done. That being said, we are going to need you to come in and have those stitches removed. And we're looking at a time frame of about 7 to 10 days from now. How does that sound? Okay, so what day is going to work for you? Okay, I have a 2 o'clock on Monday afternoon, and I have a 4 o'clock on Monday afternoon. Okay, well, how about that Tuesday? It looks like I have one at noon. Is that okay? Awesome. Okay, well, I'm going to go ahead and get Dr. Hartman, and then we can get started.